Hello, hello. Mic test 1 2 3. Hello. Hello, hello. Mic test 1 2 3. Hello, hello. Hello, hello. Mic test 1 2 3. Hello.
Good afternoon to everyone and welcome to today's session. Good afternoon to everyone and welcome to today's session. Sorry, I am a bit late, but I'll give you the latest in the NEETPG preparation. Hope you all have answered the grand test, which is conducted every Sunday. What is the feature which is common to all forms of shock? All forms of shock. Shock is fundamentally a decrease in the tissue perfusion, as all of you know very well. Which is that vitamin which is used to treat the convulsions? Pyridoxine is a very important vitamin. Vitamin B6 is the one which is being given to treat the convulsions, is what you need to remember. Mullai, Vandan and many more who are all online. Can you please punch whether the voice is loud and clear? Good to see all of you. Wound healing. What are all the things that happen? Coagulation, matrix synthesis, angiogenesis, they're all the part of the wound healing. एक wound को complete tensile strength recovery होने के लिए how long does it take? It takes about 2 years for the wound to get restoration of the complete tensile strength. Multiple pigmented puckered sinuses with the lymph node enlargement in the neck, which you are able to see here, is a classical example of a cervicofacial actinomycosis. Has got the classical appearance like this, is what you need to understand. What is that cancer caused by a virus, doctor? It is the Kaposi sarcoma, which is caused by the virus. A person is suffering from, very good, online students can now even directly click on the YouTube button and land in the YouTube to more comfortably do the chatting, right? For the instant messaging, you can even click. This is an open free session that we are having today, right? Sometimes a free session with hundreds of students is a luxury for the teacher, right? But at the same time, we need to choke an opportunity for the free session, because that's the only way that we can be able to make students buy the subscription. So as a teacher, I always want to teach to as many as possible. But in order to run an organization, we still need to have the students buy the subscription instead of it being always free. So that is a whole challenge. So I always suggest you very affordable price, we make the knowledge available to buy the online subscription. Now, a person suffering from varicose veins and he is found to be bleeding profusely from the leg. What is the immediate action? Always elevate the limb and apply the pressure bandage and achieve the homeostasis is considered to be the best way to manage. In a mammogram, what are the features which are always suggestive of a carcinoma breast? You should remember that a true microcalcification, increased skin thickness and a solid lesion with a ill-defined edge or a stellate configuration, they are all the important indicators. So this is how a breast carcinoma looks like on the mammogram. So this is one point I wanted an examiner also want from you, whether you know or not. Mammogram में benign lesion क्या होता है? What is the benign? How does a benign lesion looks like? Round, punctate, popcorn. This is all benign. Round, punctate, popcorn. When do you call highly suspicious? Suspicious lesion. If it is pleomorphic, heterogeneous, and a solid mass with irregular edges. If there is a speculation, that is highly suspicious. Similarly, long tentacles. If the lesion is having long tentacles called tentaculation, is a sign of malignancy on mammogram. And architectural distortion and a asymmetrical thickening of the breast tissue, they're all highly suspicious, is what we have to fundamentally remember. So doctor, definitely one question when they ask on breast carcinoma, mammogram, what is benign and what is suspicious of malignancy? You have to be 100% sure, doctor. Now, there is a portal hypertension, serum bilirubin 2.5, albumin 3.5, minimal ascites, the patient never had hematemesis. How do you like to classify it in the child pukes classification is the favorite question of the examiner. So fundamentally we take into consideration 5 things, doctor. Encephalopathy, ascites, bilirubin, albumin and prothrombin time. Encephalopathy, none, you call 1, mild to moderate 2, and severe grade 3 or 4 encephalopathy is 3. Similarly, ascites, none is 1, mild to moderate is 2 and severe is diuretic refractory means 3. Similarly, bilirubin less than 2, 2.2 to 3 and more than 3. Albumin more than 3.5, 2.8 to 3.5, less than 2.8. So this is how you basically classify child pukes classification, is what you have to ultimately remember. Now, what is this condition shown in the CT abdomen and what are the underlying causes for it? You can see a edematous necrotic pancreas. So it's a case of acute pancreatitis, classical acute pancreatitis, which you have to recognize. Hope all the online students, you have taken the online mock test, Sunday grand test. See, actual examiner also, if you look at the 2019 NEETPG paper, hardly how many, doctor? Around 20 questions are image based out of 300 questions. A large number of questions are single liners in the NEETPG. So it is not a tough paper at all. That is not called tough paper. I know what are tough papers. AIMS is a little tough paper because we can't predict AIMS, guys. Every time they will add some masala into the paper. But NEETPG paper is a simple, straightforward paper. If you prepare for all the stock topics, 953 topics which are made available, top NEETPG in 120 days. I want all of you to subscribe to this program on onlinemmbbs.com. Every day we have created a definitive schedule. A video, a topic, a topic, a topic. Totally 6 topics, 7 topics every day. Uska relevant videos, MCQ reviews, khatam karna. Every day 100 MCQs of that particular subject of the day. You have a grand test, a daily test. After the test is over, you also have a video discussion on that 100 MCQs. ये पूरा खत्म करने के लिए आपको 5-6 घंटे लगेगा every day, 5 hours. You give that. Go according to schedule. All 120 days, if you give yourself 600 hours, you consume the onlinemmbbs.com. Nobody will stop you from winning the entrance exam. Additionally, on every Sunday, we will have grand tests. So it is the cheap and best program, fastest way that you can achieve the goals, learning objectives, examiner expectations. Top NEETPG in 120 days. Call our helpline and tell that whatever you can afford to pay, you pay and you get the subscription. Now, doc, acute pancreatitis causes you should know, doctor. Hyperparathyroidism, hypercalcemia, hypertriglyceridemia, they're all the underlying causes. So, alcohol, gallstones, tropical pancreatitis, traumatic pancreatitis, congenital pancreaticobiliary malformations can lead to pancreatitis, autoimmune pancreatitis, hereditary pancreatitis, which is a cationic trypsinogen or a serine protease inhibitor. They are the ones which are deficient. Ischemic pancreatitis and post-irradiation pancreatitis. That's how you broadly divide the various causes of the pancreatitis. A patient following a open inguinal hernia repair has neuralgia. Then what are the nerves in the inguinal area which are involved in leading to this neuralgia? Ilioinguinal, iliohypogastric, genitofemoral, any of them can be underlying cause for the post-herniatomy neuralgia is what you have to remember. So what is the condition shown to you? It is a congenital inguinal hernia. For that, the best treatment will be herniatomy is what you have to basically appreciate. What are the various precancerous lesions of the large bowel? Familial intestinal polyposis, villus adenoma, ulcerative colitis also is pre-malignant is what you have to basically remember. Rituras rightly says पैनक्रिएटाइटिस में कैल्शियम सीक्वेस्ट्रेशन होने के वजह से हाइपोकैल्सीमिया होता है अगर क्रॉनिक पैनक्रिएटाइटिस है तो. बट hyperparathyroidism lead to hypercalcemia and hypercalcemia leads to pancreatitis. That is what you have to basically appreciate. Anal cancer. What is the best treatment? Chemoradiation is considered to be the best treatment. 5-fluorouracil 1000 milligram per meter square continuous infusion is being given. And mitomycin also is being given. Along with that, you give external beam radiation therapy to the primary tumor, perirectal lymph nodes, inguinal lymph nodes, etc. etc. So, both chemotherapy, radiation, chemo, radiation, anal carcinoma treatment. Sure, short MCQ in the forthcoming NEETPG exam. The closest differential diagnosis for this condition. So, what are you seeing here? Rectal prolapse. Rectal prolapse, closest to DD will be intussusception also looks like. Rectal prolapse is what you need to understand. What are the components of the revised trauma score? So, Glasgow score, Apgar score, Ranson's criteria. One criteria वाला क्वेश्चन तो जरूर आएगा NEETPG में. So, Glasgow coma scale, systolic BP, respiratory rate, ये सब मिला के आपको revised trauma score होता है, which you have to be very sure about. So, we leave all these slides, doctor, all these PowerPoint slides. There are almost all 1.5 lakh slides are there in our online mbbs.com video library. You don't need any other notes in the world. You have all the notes. Every video is accompanied by the PPT notes, which will help you to minimize your time for running around here and there for the notes. But you need to have your own personal 200 pages notes, doctor. Always a good habit. जो आप सोचते हैं कि मैं भूल जाऊंगा, or those areas where I go to the whiteboard and teach, right? Purposefully I become slow. So you also need to maintain that in the notebook, and every time chance is there 200 pages notebook निकालना और रीडिंग रूम में आपके साथियों के साथ डिस्कशन शुरू करना, रिवीजन करना. That is very, very important. Any number of online come, apps come, nothing is more powerful than your own personal 200 pages notebook that you maintain for the next 6 months while going for the NEETPG. आपको सीट आने के बाद वो नोटबुक को मुझे डोनेट करना. I will in turn make it available for all other students in the country. Handwritten notes is like अमृत प्रसाद, तिरुपति प्रसाद के जैसे महत्वपूर्ण होता है. आपको सीट आने के बाद don't throw away the notes. Make it available as a national asset for the future students. Now doc, what is this condition you are seeing? Cleft lip. Lip में कितने letters होते हैं? 3 letters. So 3 months, 12 weeks. So 10 weeks of life is the time where you have to repair the cleft lip. So what is this fracture? It is a subcapital femoral epiphyseal fracture. And it is a displaced fracture. That means Gordon's classification grade 4. It is. So what is the treatment for that? Hemiarthroplasty is considered to be the treatment of this fracture. So how do you, what is the algorithm for approach to the subcapital femoral epiphyseal fractures, doctor? If it is undisplaced, क्या करना चाहते हैं आप? अगर displaced है तो how do you want to manage? So whenever you have a fracture, subcapital femoral epiphyseal fracture, look whether it is a undisplaced or displaced. If it is undisplaced, irrespective of the age, internal fixation with multiple parallel screws is considered to be the management. Internal fixation with multiple parallel screws is the management of undisplaced fracture. Then if it is a displaced fracture, आप age देखना पड़ता. Age is less than 70, then age more than 70. More than 70. Third scenario, patient is demented, elderly or demented, or has a lot of premorbid conditions. What do you want to do? Suppose the age is less than 70, even if it is a displaced fracture, you prefer to do internal fixation with multiple parallel screws. But if the patient is demented or institutionalized and has poor premorbid accompanying conditions, then we have to do cemented hemiarthroplasty. Cemented hemiarthroplasty. If the age is more than 70, then you have to do total hip arthroplasty. So this is how you approach the problem of subcapital femoral epiphyseal fracture is what you have to basically remember. Whatever, very happy to see 36 online students. When we don't make the program free and make it available on YouTube, and we run it in the under the sleeve of online MBBS and force you to buy subscription, somehow maza nahi aata. Lot of students, you are all punching your answers and we have a wonderful time together. Nothing like that. But still, there is no other way. Sometimes we need to choke the program and ask you to subscribe. So please do subscribe, and it is also a very useful program. Top NEETPG in 120 days. That is a best strategic program. 600 hours of investment of your time is going to ensure you to definitely get the seat. Now, which is not a radiological feature of osteoarthritis. There is a narrowing of joint space, osteophyte formation, subchondral stenosis, cyst formation. They are all the things that are seen in the degenerative arthritis, that is osteoarthritis is what you need to remember. So what is this deformity that you are able to see, doctor? This is a dinner fork deformity is what you should basically remember. So what is empyema necessitans? Pleural empyema with an extension to subcutaneous tissue is called empyema necessitans. Always bronchogenic carcinoma में स्मॉल सेल कैंसर जल्दी मेटास्टेसिस हो जाता, छोटू जो होता है ना बहुत जल्दी जल्दी भागेगा, जल्दी भागे तो हर एक ऑर्गन को चले जाएगा. So that is the reason 2 points about small cell cancer. Prognosis poor, already metastasized by the time of discovery, no role for surgery. कहाँ काटेगा, पूरा बदन को मेटास्टेसिस हो गया तो कहाँ जाके काटेगा आपको, आप जाके नहीं कर सकते. Surgery has no role in small cell cancer is what you should remember. Degenerative myopia में the retina is degenerated. That's the reason there is a chance of developing retinal detachment as a complication. Pseudoexophthalmos. It looks like exophthalmos. When do you see that? When there is a high myopia, lid retraction, facial nerve paralysis, ये सब चीजों में pseudoexophthalmos is a feature. अच्छा भाई, ये टिम्पैनिक मेम्ब्रेन कैसे दिख रहा है आपको? Multiple perforations है. Multiple perforations is the feature of tuberculous otitis media is what you need to remember. So अगर आप ऑनलाइन टेस्ट लिए तो ये पूरा इमेज बेस्ड क्वेश्चंस एवरीथिंग, करेक्ट आंसर है तो 4 marks, wrong answer है तो -1 mark. All that you are scoring, everything you get, all 300 questions. In addition to that, we will have about 120 questions which we will pick up and have a discussion. And all 300 questions ka explanatory answers, PPT will also be available in the online mbbs.com. So that is the reason subscribe to the top NEETPG in 120 days. We also give 30 mock tests with discussions as a complement along with the top NEETPG in 120 days program available on the online mbbs.com. Now doc, raised intracranial tension hai to you get bradycardia, papilledema, headache, they are all the features. Brachial plexus injury, it results from the traction of the shoulder. Suppose if somebody is falling down and held the branch of the tree. Conservative management, good prognosis. Good prognosis with conservative management. No need for immediate surgery. Ramsted's operation, you do it for congenital hypertrophic pyloric stenosis in order to relieve the stenosis, as all of you know. Bleeding per rectum क्यों होता है बच्चों में? Rectal polyp is the most common cause. Locally invasive malignant tumor is a amyloblastoma. Burnt surface. What is the temperature of the water to cool? Typically 15 degrees Celsius is the ideal temperature. Now comes an interesting question. By up a pylography देख रहे हैं, how is this looking like reverse J? This is called reverse J appearance. J को उल्टा करे तो जैसे लगता, J लेटर J को उल्टा करे तो जैसे लगता वैसा pelvic ileal system dilate हो गया और reverse J appearance आ गया. This is called retrocaval ureter. Typically has a reverse J appearance. Now the question is, how do you manage it? Cut and suture the ureter is the way you handle the retrocaval ureter. Pancreas के superior border के ऊपर, what is the structure that will be passing? All of you remember that splenic artery typically passes along the superior border of the pancreas. So doctor, one is knowledge. knowing what examiner want from you. Second, understanding out of all the examiner's expectations, कितने चीज हमको मालूम है, कितना नहीं मालूम है. जो नहीं मालूम है वो टॉपिक्स को हम प्रिपेयर होना है नेक्स्ट 6 months. वो खत्म करने के बाद your knowledge, you are a pond of knowledge, you are Maharshi. You need to apply that in the actual exam scenario. That is where your mock test regularly checking how many. Can I cross the 1000 score? Can I cross the 1000 score out of 1200 total score or not? You have to try. So that is very important. Contraction of the detrusor is parasympathomimetic fibers of the craniosacral, sacral plexus, S1, S2, S3, S2, S3, S4. Parasympathetic supply will make detrusor to contract. Cortex to medulla ratio कितना रहता है? 35 to 45% is the cortex to medulla ratio. About the cerebellum, you have to be very sure. Some questions I will try to run fast because I am imagining that you have solved these questions as a mock test and participating in discussion. That is my expectation from you. Unlike the remaining days where we discuss very long. So doc, vermis is present in the midline. Then we have 3 types of cerebellum, doctor, which you have to be very, very sure about. Once more, top NEETPG in 120 days program में anatomy में cerebellum is day 2 or day 3 topic. अगर आपको topic list 953 topics in 120 days रिविजन का टॉपिक लिस्ट नहीं मिले तो पीडीएफ मिल जाएगा, आपको फ्री में मिलेगा. आप हमारा हेल्पलाइन 9000868356 को कॉल करो और get the 953 high yield topic list which is discussed in 600 hours on the onlinemmbbs.com. So you have archicerebellum, then paleocerebellum, neocerebellum are the 3 things. So flocculonodular lobe जो होता है डॉक्टर, that comes under archicerebellum. उसका मेन फंक्शन क्या होता है? Posture and eye movement is its function. Paleocerebellum, typically vermis and in the anterior lobe, plus part of the, this is the superior vermis, part of the anterior lobe, inferior vermis, which is the part of posterior lobe, comes under paleocerebellum. It has a wide connection with spinal cord. So progressive movements is the main thing with paleocerebellum. Paleocerebellum. Then you have the neocerebellum. The cerebellar hemispheres come under neocerebellum. And the vermis in the posterior lobe, vermis in the posterior lobe also comes under neocerebellum, and it coordinates with the cerebral cortex, and the modulation of the movement and speech. भाई सेरिबेलर डिसऑर्डर्स आ गया तो स्पीच कैसे हो जाएगा? स्कैनिंग स्पीच. जैसे दारू पी के बात करते ना, फारू तो खाओ, दारू पी के जो बात करते ना, स्कैनिंग स्पीच. That comes if the neocerebellum got affected. That is what you have to emphatically remember for the tomorrow's exam. So vestibulocerebellum, flocculonodular lobe mainly. It maintains equilibrium. Spinocerebellum, anterior lobe mainly, and the vermis. And it is concerned with the unconscious proprioception because it has connection with the spinal cord. Pontocerebellum is the middle lobe mainly, and it coordinates the fine movements and talk to the cerebral cortex. This is what you have to emphatically remember. Posterior longitudinal ligament continues as what? It continues as membrana tectoria. So this is the typical tectorial membrane and posterior longitudinal ligament. So tectorial membrane is the upper part of the posterior longitudinal ligament, and it connects the C2 to the intracranial aspect at the base of the skull. So that is the tectorial membrane. About corticospinal tract, what is a true statement? Goldie Arora says, sir, if I pay 2000 rupees, sir, can I get the access to the live class for 6 months? Very difficult question. Why to pay even that 2000 also, right? So, no worries, doctor. Please give a call to our helpline and they will help you whatever you can afford to pay. Like a donation you pay and prepare for the exam, get benefited. If 10,000 students join or 1000 students join or 10 students join, बात एक ही है हमारे लिए. We provided the video, we continue to teach, and we provide the PowerPoint, right? So, unlike, yes, we are definitely commercial, but we are the ones who are responsibly commercial. Like we believe that you give free, it comes back 3 or 4 times back, right? So that is how we do. So since running an organization with so many people, their salaries, rents, everything we need to pay, that's becoming a challenge if I only do free. That's the reason all our employees said, sir, we'll put gun on you. Don't make it completely free, sir. Let those who can afford to pay, let them pay and then access the content. So please feel free, feel easy. Think that you are a extended fraternity of us by being doctors. Aspire to become a great doctor with an MD. So with that intention, according to your affordability, you can always pay, right? So regarding corticospinal tract, what is except? It also called pyramidal tract. It forms pyramids in the medulla. 80% are crossed, but maximum fibers don't come from primary motor cortex. Only 1/3 come. 1/3 from sensory motor cortex. Majority come from the 5th layer of the cerebral cortex. Axons of the pyramidal cells are the main contributors, is what you have to basically remember. So, Monica, no worries, please do call our helpline and they will give you the best offer. Now, stomach secretes which neurohormonal substance for the energy balance? Ghrelin. Ghrelin is the one which you need to basically remember. Ghrelin is called the circulating hunger hormone, and it is both a hormone in the endocrine system and also ghrelin is a neurotransmitter in the nervous system, is what you have to basically remember. And it is called as circulating oryxygen or a circulating appetite regulatory hormone or a appetite enhancing hormone. It is also a growth hormone secretagogue and it is a motilin related peptide. Now comes the most important question, doctor. Definitely examiner is going to ask this question. A slide up, you have to mug it and put it in your pocket. There is no other way, right? If you go to AIMS, PGI, All India, all these question banks, अगर आप revision करें तो doctor, you will know what are examiners expectations. उसमें कुछ भी tension नहीं है. अगर आप interest लेके revision करके master करना, that is most important. So what lead to increased Ghrelin? What leads to decreased Ghrelin is very, very important. Leptin increases the Ghrelin. Fasting increases Ghrelin. Then growth hormone, releasing hormone, thyroid hormone, sleep deprivation, lean people who have low BMI also have a high Ghrelin, and anorexia nervosa, they have high Ghrelin. ये तो जरूर आएगा entrance में. How will be the Ghrelin levels in anorexia nervosa? You have to be doubly sure. Any food intake decrease Ghrelin. Glucose, lipid, insulin, somatostatin, they all decrease Ghrelin. Obesity with a high BMI decrease Ghrelin. Then PYY and PP also decrease the Ghrelin is what you have to fundamentally remember. Which part of the brain is very sensitive to hypoxia? Hippocampus is very sensitive. What is the rate of oxygen delivery, doctor? देखो ऐसे चीजें purely numerical single liners. 200 questions NEETPG 2019 में single liners है. No big deal, right? So, but all 300 questions come from that 953 topic list है ना डॉक्टर, वहां बैठा हुआ है, उसको मास्टर करना. करे तो next 6 months में all your goal is, can I be able to finish that 953 topics को garma garam 10 points about each of it, can I master or not? That is very, very important. Good. Amrita says leptin Ghrelin have an inverse relationship. But leptin Ghrelin have an inverse relation, but increased leptin stimulates Ghrelin production. So increased Ghrelin leptin के वजह से होता है. That's a point. 250 ml per minute. Which renin-angiotensin is component is produced in the lungs, doctor? Or surfactant? Surfactant is produced in the lungs. Yes. What is the non-respiratory function of the lungs? Sodium balance. In normal person, what is that lung volume? At the functional residual volume is called as. Relaxation volume is the name given for it. Maximum voluntary ventilation is measured for how long? It is measured for 60 seconds is what you need to remember. During normal inspiration, how much does diaphragm go down? Diaphragm goes down by about 1 to 2 centimeters. What is this breathing pattern shown to you in the image, doctor? And what is the underlying cause? It is an example of a chain Stokes breathing pattern. So you should recognize वो pattern देके how to recognize the breathing pattern. हम बहुत बार इसके बारे में चर्चा कर चुके. So it is typically in case of congestive heart failure. So what are the various causes for the chain Stokes breathing you should know? CHF, coronary artery disease, hypertensive cardiovascular disease is all chain Stokes. Stroke, subarachnoid hemorrhage, trauma, cerebral tumor, meningitis, encephalitis, narcolepsy lead to chain Stokes. High altitude, prematurity, elderly status, CO2 narcosis, uremia, they all can lead to chain Stokes is what you have to remember. Foam cells are typically seen in. Whenever CMV lead to encephalitis, if you do brain biopsy, you can find the foam cells on histology. The E6 gene product of HPV causes malignant transformation mainly by acting on which gene? P53 gene. Humans way, the most common virus leading to cancer is human papilloma virus. The growth of the virus in embryonated egg. Eggs are incubated for how long? 5 to 12 days is the time of incubation. Most rapid test क्या होता है मलेरिया के डायग्नोसिस को? It is HRP2 antigen is a very rapid way by which you can identify the malaria. What is this organism shown in the peripheral smear, doctor? Banana shaped organism. What is this? So, Plasmodium falciparum. Falciparum को आइडेंटिफाई करने के लिए रैपिड डायग्नोस्टिक टेस्ट में LDH का इस्तेमाल करते हैं. So LDH translates pyruvate into lactate and that converts tetrazolium into formazole. So that is a immunomagnetic capture and colorimetric detection of the malarial biomarker Plasmodium falciparum's LDH is what you need to understand. Now, 18-year-old has meningitis 5 days after taking bath in a pond. So, what is that organism? Naegleria fowleri is a one which typically has that kind of a pond history which you should be very sure about. About Trichomonas vaginalis, it has a twitching movement, 5 flagellae, it produces a green frothy discharge, but it is the trophozoite which is the infective stage, not the cystic stage, is what you have to remember. Ring form of babesia, how does it differ from the malaria? So what is the specialty of babesia? Just like malaria is an intra-erythrocytic parasite, babesia also is an intra-erythrocytic organism is what you need to remember. Ritu rightly says Trichomonas trophozoite जो होता है both diagnostic and also infective. So they lack the pigment, the ring forms of babesia. Which is that stain which is suitable for fungal demonstration in tissue? PAS stain. So this is the PAS positive material, fungal hyphae are recognized. PAS is a fungal stain. This is another example of a PAS staining of the fungi. Below what value of the neutrophil count do you get pulmonary aspergillosis? Less than 500 to 1000 per microliter. For which drugs you want to do therapeutic monitoring? Lithium aminoglycosides, anticonvulsants you have to do. Which is a idiosyncratic reaction. Chloramphenicol जो होता है ना doctor, you don't know which patient will end up in aplastic anemia, who doesn't. Intolerance to a drug, at what dose does it occur? Therapeutic dose only. If you are constantly taking, then that lead to development of intolerance. Then which is called the gatekeeper of GIT. It is the ATP binding cassette transporter. HDL होता ना, HDL का specialty क्या है? पूरा peripheral tissues में cholesterol को पकड़ के like a scavenger it picks it up and then drops it in liver. That is the function of HDL. So HDL जो होता है उसका वो अपना काम करने के लिए ये ATP binding cassette transporter is required. So ये ABC transporter को गेट कीपर बोलते हैं GIT में. That's what you need to understand. So this ATP binding cassette transporter is having a role in sphingolipid metabolism and the lysosome free cholesterol sequestration, and any mutation of this has a role in causing the drug resistance of the cancer and cardiovascular disorders because cholesterol metabolism get affected, and Alzheimer's disease may it has got a role, and neurological manifestations occur because of that. So any mutation of the ABC cassette protein, it is called as Tangiers disease, which lead to a severe HDL deficiency is what you have to remember. Pharmacogenomics. What is the phenomena that can be explained with pharmacogenomics? कुछ लोगों में इरिनोटेक्टान का इस्तेमाल करे तो इरिनोटिकान का उनको न्यूट्रोपिनिया डायरिया हो जाएगा, दूसरे लोगों को नहीं होगा. So that is an example of pharmacogenomics. Now category X drug क्या होता है इन चीजों में? Isotretinoin should not be used. It has a strong teratogenic effect is what you have to basically remember. What is the cardiac dose of dopamine? 2 to 10 micrograms per kg per minute is the cardiac dosage. Ivabradine, this many times we discussed in our evening sham pe charcha, chai pe charcha. Ivabradine is used in the management of the stable angina is what you have to remember. So how does ivabradine act? Ivabradine selectively inhibits the sodium current of the inward channels on the sinus node. By doing so, it reduces the diastolic depolarization phase, and that will make the heart rate reduction and myocardial oxygen demand also will come down, and hence it is used in the management of the angina is what you need to remember. Now, which drug is used in congestive heart failure to relieve the congestive symptoms, but it does not have any inotropic action? Nebivolol is the one which is specifically used. इसके पहले भी हम चर्चा किए, फिर भी now I want to once more tell you what are the different generations of beta blockers. You should remember, doctor. First generation वाले beta blockers typically they are non-selective. They increase the alpha mediated vasoconstriction, alpha receptor mediated vasoconstriction. Propranolol is the first generation. Then second generation, they are beta selective. They are less vasoconstrictor. And what comes under this? Atenolol, metoprolol, bisoprolol, they all come under second generation. What are third generation? Third generation होता है vasodilatory, especially on the resistance vessels के ऊपर, they have vasodilatory effect. Under the third generation comes carvedilol, celiprolol and nevibolol. देखो कितना इवॉल्व हो गए थे हम. First generation were like face to face classes. They are vasoconstrictive. Second generation are beta 1 selective, less vasoconstrictive. They are like an online recorded video or DVD based video lectures. More advanced आज का क्या है चल रहा है? Vasodilatory. Third generation, they are like live online classes. Carvedilol, celiprolol, nevibolol. They are all the ones which you need to basically remember. So, doctor, जमाना बदल रहा है. The learning methodologies with the modern advent of technology, live online, where you are able to interact seamlessly with the teacher. एक chat window रहे तो, एक छोटा मोबाइल फोन रहे तो, एक 4G कनेक्शन है तो, बस जिंदगी खुश. कहीं भी बैठो, पेड़ के नीचे बैठो, समुंदर के बीच में बैठो, आप आराम से प्रिपेयर हो सकते. So that is like a third generation beta blocker, which is vasodilatory. Almost propranolol was vasoconstrictory, that became vasodilatory by the time you came to third generation. So doc, एक nevibolol टैबलेट देके तो आपको कॉन्फिडेंस मिल जाएगा. But what is more superior than nevibolol? Bisoprolol is more superior. Bisoprolol is indicated for coronary artery disease. And अगर CHF patients को bisoprolol दिए तो studies have proven that mortality कम हो जाएगा, unlike the nevibolol. And it has a low plasma protein binding, whereas nevibolol is high protein binding, 98% protein bound. So they are the main differences. Now, trimetazidine, how does it basically function? It inhibits the mitochondrial LC3 cat. Acha bhai, a LC3 cat, where do we find it? Basically, if you look at the myocardial cells, they consume the fatty acids for the production of their ATP. But there is a very costly affair. It is like going to 5-star hotel and eating idli. Very costly. Coffee piye to 300 रुपए हो जाता. There is a more better, easier, less oxygen demanding way of producing ATP. That is by the glucose metabolism. So somehow somebody should go and tell to myocardium, भाई myocardium आजकल ऑक्सीजन नहीं मिल रहा है, आप 5-star में फैटी एसिड इस्तेमाल करके खाना खा रहे तो पैसे देने के लिए क्रेडिट कार्ड में पैसे नहीं है. टाइम आ गया, आप एक रोड साइड का सिंपल इडली खाओ, 5-star नहीं मिलेगा. So कौन बोलेगा? This LC3 cat is involved. Somebody go and inhibit LC3 cat, it makes the myocardium realize that, oh, fatty acid को इस्तेमाल नहीं करना, अभी से मैं किसको इस्तेमाल करना? ग्लूकोज का इस्तेमाल करना, and myocardial oxygen demand will be lesser. That is what you require in a patient who has a coronary artery disease. So trimetazidine is the one which brings that transition by inhibiting the LC3 cat, is what you have to basically remember. Metabolic modifier, which an anti-anginal drug can be used safely in the people who have erectile dysfunction. You can use the PFOX inhibitor like trimetazidine. Now, what is this condition you are seeing? You are seeing Arnold-Chiari malformation. So you should know what are all the different types of Arnold-Chiari. So in this you find hypoplasia of cerebellar vermis, herniation of the cerebellum, flattening of the base of the skull. They're all the things, and it is associated with hydrocephalus. So you have Cheery 1, Cheery 2, Cheery 3, Cheery 4. Out of that only Cheery 2 is called Arnold Cheery. Arnold Cheery होता है Cheery 2. इसमें you have a hydrocephalus, a kink in the medulla, herniation of cerebellar tonsils, and because of that the CSF drainage get affected in the spinal cord. Central canal become pushed and that lead to syringomyelia. So what is this content you are able to see in the figure? What is the content of this? You should remember what you are seeing here is a meningocele. Dura mater is the content of it. What is the best method to estimate the proteinuria in a child who has nephrotic syndrome? Dipstick testing is the best method. Now with regard to a child who has an acute kidney injury, we use the Schwartz formula. But the Schwartz formula depends on the age of the child. By what is meant by Schwartz formula? Creatinine clearance is equal to K into height in centimeter divided by serum creatinine. This K जो constant है, it depends upon the age. It is 0.45 the infant. It is 0.55 if it is a child and adolescent. It is 0.7 if it is an adolescent male, is what you have to remember. In this axial post-gadolinium T1 weighted MRI, what you are able to see? You are able to see a optic nerve glioma. So, optic nerve glioma is the one that you see. Neurofibromatosis type 1 is what you should remember. This is pure numerical question. लेंस का पावर कितना है? 16 diopters. ऑर्बिट का वॉल्यूम कितना है? 29 ml. Anterior focal point will be at what distance in a reduced eye? 15.7 mm. And what is the distance between the nodal point and the cornea in a reduced eye? 7.2 mm. ऐसे चीजें नहीं मालूम है तो it is like dismissal of Rohit Sharma in the semi-final. Very disheartening dismissal. I don't want that. Which intraocular muscle attaches very close to the limbus? Medial rectus attaches very close to the limbus. Hyphema, what does it suggest? It suggests a intraocular trauma. Hyphema. 30-year-old female wears a contact lens for 2 months continuously. What are the complications of contact lens? Contact lens will lead to giant papillary conjunctivitis, microbial keratitis, increased sensitivity, etc., etc. A swimmer after coming from the swimming pool with a redness, mucopurulent discharge. So, what is that he is having? Adult inclusion conjunctivitis. It is caused by chlamydia is the one that you need to remember. Mafuki syndrome में क्या होता है? Enchondroma. So what are these are the typical enchondromas of a Mafuki syndrome. And remember both. B, brain gliomas. O, ovarian carcinomas. S, soft tissue hemangiomas. E, enchondromatosis. The combination is called Mafuki syndrome is what you should remember. Now doctor, what is the age for doing a tendon transfer in a post-polio residual paralysis child? More than 5 years you have to wait. Popliteal entrapment syndrome. How does it present? Exercise-induced cough claudication is the way that it basically presents. So, complete congenital talipes equinovarus. Expert hona doctor आप. On the onlinemmbbs.com video library, top NEETPG in 120 days में, orthopedics में, CTEV का, पूरा DNB questions, all India questions, concept of the CTEV, club foot, what are the different surgical procedures, how do you operate, when do you operate, सब कुछ हम discuss करके बैठे. So do a revision. It is typically done at 1 to 3 years. Ponisetti technique typically involves posteromedial. अगर वो fail हो गया तो it is managed with posteromedial soft tissue release is what you should remember. परतिस में क्या होता है? Femoral head, there is a lateral extrusion. Metaphyseal cysts will form. Increased medial joint space. They are all the important radiological features of pertis. What is this condition? Baker's cyst. How do you like to describe it? Pulsion diverticulum of the knee joint is the Baker's cyst, which is caused by a chronic disease of the knee joint. Anatomical snuff box में अगर tenderness हो गया तो you will think of scaphoid fracture. Then what is this bone tumor where you are able to find a sclerotic nidus, typically osteoid osteoma. So it is the most common true benign tumor. It is diaphyseal in location between 10 to 30 years and bone scan shows an increased uptake. They are all the important features. Fasciotomy में what do you remove? You remove skin, superficial and deep fascia, not muscles. Which area is called no man's land, doctor? Zone 2 is also called Bunnell's no man's land. And the results, if you try to repair any tendon injury here, are very poor because, and that's the reason you should not attempt. Now, first repair in a hand injury, kisko karte? Bone is the one which is first repaired. Decreased carrying angle को क्या कहते हैं? Cubitus varus deformity is decreased carrying angle. Segmental demyelination अगर हो गया तो what do you see in a nerve conduction study? Typically there is a decreased camp amplitude is a classical feature in the nerve conduction study. Crutch palsy, दारू पी के कोई बैठ गए तो Saturday palsy is radial nerve. Similarly, crutches पहन रहे तो that typically lead to radial nerve injury. What is the area which is autonomous zone where there is no other overlap with ulnar or median nerve? कहाँ होता है? First dorsal web space purely by the radial nerve. So you should remember this, doctor. The lateral cutaneous nerve of the forearm has a significant overlap with the superficial radial sensory nerve. Then generally अगर ulnar nerve or median nerve is injured, the sensory loss is significant. Whereas radial जो होता है, if it is injured, there is a lot of overlap. So it won't be disabling in nature. That is what you should remember. So the autonomous sensory zone for the radial nerve is there on the dorsum of the first web space is what you have to remember. Where do you see compartment syndrome? Fracture of the proximal tibia typically lead to development of compartment syndrome. BCG vaccination कैसे देते हैं? Intradermal is the BCG vaccination. Leprosy in India, almost 10 per 1 lakh population is the annual detection rate. DOTS plus क्या होता है? Plus is to handle the multi-drug resistance. So, intensive care 6 to 9 months, keramycin, ufloxacin, cycloserine, ethambutol, pyrazinamide, they are all given. Continuation phase is for 18 months. Ufloxacin, cycloserine, ethionamide and ethambutol are given. So this DOTS plus is to cover the multi-drug resistant TB is what you should remember. What is the preventive cause of blindness? Always vitamin A deficiency. कितना वेस्ट हिप रेशियो है तो आप ओबेसिटी कहते हैं. मेल्स में मोर देन 0.95, फीमेल्स में मोर देन 0.86. नॉर्मल वेस्ट हिप रेशियो कितना होता? Males it is less than 0.85 and females less than 0.75. So that brings us to the end of the today's grandest NEETPG discussion and review. Tomorrow once more 6 to 8, let's catch up and do a wonderful revision. There are 200 more questions left over in pharmacology. Already we discussed 900 questions. Topic wise of the last 15 years, NEETPG All India. We continue that, and end of this discussion, what is important? Catch those points, catch those topics where you are really getting clean bold. You're not confident. Go back to the at least 5-6 topics pakado. Go back to the onlinembbs.com and do the video revision. So good luck. Enjoy a great Sunday and a World Cup match. And we will meet tomorrow at 6 p.m. Thank you.